Every drug has two faces. It can heal, but in the wrong dose, it can harm. So, how do we measure the safety margin between the helpful dose and the harmful dose? That's where the therapeutic index comes in. The therapeutic index of a drug is a ratio of the dose that produces toxicity to the dose that produces a clinically desired effect. We use two key terms, TD50 and ED50. ED50 is the effective dose for 50% of the population. TD50 is the toxic dose for 50% of the population. Imagine having a 10 persons population. The dose when 5 of them, which is 50%, experiences the desired effect is known as the ED50, while the dose when 5 of them, which is 50%, experience the toxic effect is known as the TD50. Now, the formula is therapeutic index equal TD50 over ED50. The higher the therapeutic index, the safer the drug. The therapeutic index curve draws the relationships between dose and response percentage, with the dose on the x-axis and response percentage on the y-axis. First, representing the therapeutic effect, when 50% response achieved, the dose is ED50. Second, representing the toxic effect, and where 50% toxicity achieved, the dose is TD50. And the range between the therapeutic and toxic level is known as the therapeutic index. When therapeutic index is small, we say the drug has a narrow therapeutic window, like warfarin. And when therapeutic index is large, we say the drug has a wide therapeutic window, like penicillin. In real life, the therapeutic index of a drug is not just a number on paper. It comes from clinical trials and years of accumulated experience. Doctors usually look at a range of effective doses and a range of toxic doses. For most medicines, we want a high therapeutic index so there's a comfortable safety margin. But here is the twist. Some very important drugs have a low therapeutic index, and we still use them because the risk of not treating the disease is far greater than the risk of side effects. Let's look at some examples. Warfarin, a blood thinner, has a very low therapeutic index. A slightly higher dose may cause dangerous bleeding, yet without it, patients risk deadly clots. Penicillin, on the other hand, has a high therapeutic index. We can safely give doses much higher than the minimum effective dose without fear of serious side effects. Other classic drugs with low therapeutic indices include cyclosporine 100 to 400 nanogram per milliliter, carbamazepine 4 to 10 microgram per milliliter, digoxin 0.8 to 2 nanogram per milliliter, phenytoin 10 to 20 microgram per milliliter, and quinidine 2 to 6 microgram per milliliter. For these drugs, careful monitoring of blood levels is critical. So, how much is too much? The therapeutic index gives us the answer. It reminds us that the drug therapy is always a balancing act, maximizing benefit while minimizing harm. The wider the safety margin, the better. But even with a narrow therapeutic index, if the drug saves life, the risk is worth it, as long as we respect the dose. Alright, let's test your understanding with a quick quiz. Question number 1. The therapeutic index of a drug is defined as A, B, C, or D. Question number 2. Which of the following is a narrow therapeutic index drug that requires careful monitoring? A, B, C, or D? If you learned something cool today, smash that like button and hit subscribe subscribe for more bite sized medical lessons. Drop your answers and questions in the comments. Until next time, stay curious.